discussion is going to be talking about the ABCs of Medicare. And this topic, whenever I talk to somebody, they're like, what are you talking about? Because these are the 7 choices that you have available. Now, these are just 7 broad choices. If any of you have ever been out to the Medicare.gov website, then you would actually see that there are probably in Steuben County 28 to 29 choices available to you, and Chemung County about the same. So if you have to pick what plans you're supposed to have, it's sort of like eeny, meeny, miny, moe. It's very confusing. Recently I had this conversation with my mother, who is starting to become very interested in this particular topic, and she said, well, what's A? I mean, again, what do I have to have A for? And I was explaining what A covered. And then we went right back to, she said, well, I thought that was Part A. I said, you know, let me make a map for you. So I happened to find this particular sort of combination out on the Medicare website, and I thought it would be very helpful. It's also in your packet. But it just goes to show that there are many different options available. Now, when we talk about Medicare, Medicare has a very particular enrollment period. For individuals that are turning age 65, you have 3 months before, you have the month of, and then you have 3 months after. So it's basically a 7-month window that you can enroll in Medicare without any penalty. And here's the kicker. If you don't enroll in Medicare when you're supposed to, now there's exceptions to this rule, but you can see there's 10% penalty for every 12 months. So you actually will have to pay a 10% premium penalty for every 12 months that you don't enroll. There is a special enrollment stage for working people at age 65. Most plans, most employer plans, so if you're still working at age 65, most employer plans will still require you to sign up for Part A, but Part B can be added later, and this will generally avoid the late enrollment. So let's dig into exactly what are the various parts of Medicare. So there's Part A. Part A is your hospital insurance. That's the majority of it. It pays for any hospitalization you have. It pays for short-term skilled nursing. You have something replaced. I always say something because it could be a hip, an arm, a knee, whatever it is. You have to go into skilled nursing for short-term, then Part A will cover for it. If you have to go in for long-term, Part A does not cover it. So it's short-term skilled nursing only. If you need any home health care, Part A is going to cover it, and then if you need hospice, Part A is covering it.
Do they define short-term by time period?
It's usually 30 to 60 days. It's the idea that you're going to recover. So if I've, even like a stroke victim, the idea that they're going to recover is likely, then they'll cover it for that 30 to 60 day period. After that, if there's no sign of recovery or it doesn't look like they're getting better, then it will switch.
So does it have to be what they classify as rehab?
It's sort of rehab. I mean, but think about a person that has a stroke. It's not necessarily rehab. They don't need the hospitalization, okay, but they need ongoing custodial care during that recovery stage. So the deductible, and this is the part that scares everybody. Your deductible, if you just have normal Medicare and you're under Part A, your first year deductible, or per year deductible I should say, is almost $1,300. You go into a hospital, you have to pay the first $1,300. After your deductible is met, then day 0 to 60, you have a co-insurance of nothing. So Medicare picks up 100% after the deductible. Then day 60 to 90, you're going to pay $322 per day. That's your co-insurance per day. Day 90 and beyond, you're going to pay $644 up to a maximum of 60 days per lifetime. So what does that mean? That means that if you go beyond day 91 and you stay in the hospital for 30 days, you have a remainder of 30 days that Medicare will help you at some point in time. So that's per occurrence, per lifetime. If you're going to be in the hospital for an extended period of time beyond that, basically what they're saying here is once you get beyond 91 days, you will use up your 60-day maximum, and you will no longer have coverage. You will have to pay 100% if you just have Part A and B. This is just Part A and B. So let's talk about Part B. Let's see if I can get this to work. So Part B is basically your medical insurance. Your doctor's services, your preventative care, your durable medical equipment, that's your walkers, your canes, any kind of durable equipment, outpatient services, x-rays, and labs. Now here's an area I want to point out too that's a little bit dangerous. What's outpatient and what's inpatient? Because remember, inpatient is covered under Part A, outpatient is covered under Part B. Have you ever heard the story where somebody goes into the ER and they treat the patient, but don't ever admit them? Guess what it's covered under? Part A, or Part B, excuse me, because it's never considered inpatient. It's never considered the hospital. So what do you think they get paid more? The hospitals get paid more under Part B, so they're going to try to keep somebody from being admitted if they can. But the patient might not get the care that they need under Part B because they're in an emergency room setting. They're not admitted. They're not getting that ongoing care. I saw this happen with my father-in-law so many times it wasn't funny. I knew what was going on. I could call him on the carpet, but I've seen a lot of people say, well, they sent him home after a day of being in the ER, and we really never felt comfortable with the treatment that they got. Now, just because we're on this page, I want to flip real quick to what the costs for Part B are. So for 2016, and right now they're coming out and they're saying, we haven't quite released the 2017 costs yet. See, 2017 costs aren't yet available. This is from the Medicare.gov website. They're telling us that that's not quite available yet. So the Medicare costs for Part B aren't as simple as you would think. Traditionally, we're paying somewhere around $105 a month. Now it's based on income. So depending on where your income is, it depends on what your premium is in Part B. So if you hear people talking about 104, 112, could be all the way up to $180 depending on where your income is for the year. So that ranges. And I just want to bring that to everybody's attention. But they don't yet know where those costs are going to fall. We're in almost November. It's going to start in January. You think maybe that ought to be planned? The sad part is, as you heard, Social Security is rising a whopping 0.2%. Woo-hoo! A whopping. I'm going to tell you that your premium is going to go up much more than that. Whoops. Deductible on Part B, $166 per year. You pay 20% of anything that is Medicare approved. I want to snap back just for a second. Remember what I said about outpatient services right here? And then fast forward to 20%. So you're an outpatient, you're in the hospital, you're responsible for 20%. If you don't have any supplement, you just have Part A and B, your responsibility is 20%. It's not a big deal when it's 20% of your doctor's visit or an x-ray or something like that, generally speaking, but 20% of spending a day in an emergency room is very expensive. So when we talk about what coverage you want with regards to Medicare, people will look at the premium and say, well, I want to stick to just Part B because it's $112 or in that range. And then I start sharing with them what their risk is. because there's no lifetime maximum here. If you have a catastrophic year, you could pay 20% out of pocket ad nauseum. If I could figure out this remote, it would be great. So Part B financial assistance is available. There are some Medicare savings programs out there. You do have to be pretty low income in order to qualify. There's 4 different programs. Most of them are very much tied, well, all of them are very much tied to income. Some can actually be disability driven, and people can actually still be working. It's generally not very helpful to people because it's Part A, and remember, Part A doesn't really have a premium per se. But there are some programs out there if people have low income being pretty significantly low, like around $1,100 or $1,000 a year, a month. Gosh. In order to qualify. Married income can be around $1,300 a year, single resources, and they consider resources an IRA, anything in the savings account, anything that you might have. For married, resources have to be less than $11,000. If you're Medicaid eligible, then you automatically qualify. So it's very challenging to actually become eligible for financial assistance. But we do know people that this benefits, and basically you can go out to the Medicare.gov website, and there's a link that actually talks about how to qualify for financial assistance. It links you back to the state that you're associated with, and you go through an application process that asks for some data like, prove to us this is what your income is, tell us about your expenses, and then list what your assets are. If you qualify, they will pay 100% of the premium of Part B and usually Part D as well. So when I say they, it's kind of a Medicaid-related system, but it is financial assistance. So, somebody who's living on a limited budget can benefit from these programs. And, $112 might not seem like a lot a month, but $112 can seem like a lot to somebody who's living on $1,000 of income a month. So then there's Part D. So we've done A and we've done B. I'm going to skip over C because C has a special little provision to it. So I'm going to skip now to D. Again, the first 2 programs were government sponsored. So there's a trust that's actually funded, and those payments are made out of those trusts, Part A and B. Part D actually switches to private insurance. So when Part D was founded, the government didn't want to take on that additional responsibility of paying for prescriptions, because that's the most expensive part, to be honest. So they formed alliances with insurance companies and said, we'll give you money. We'll actually give you money to help keep the premiums down on this, but this is your get. You take the major loss. We're just going to sort of fund this to a certain extent. It's a contract, a government contract with the different insurance agencies. The premium is going to vary widely. If you go out, again, on Medicare.gov and you look at the number of different premiums that are available, different policies that are available for Part D, there's probably 20 plans that you can choose from. So it's a matter of really knowing your prescriptions and understanding what the different insurance companies are calling different tiers. I know this time of year, so I usually spend about the first 2 weeks of open enrollment dealing with clients that have employer-related plans, because their open enrollment is very short. And then I immediately switch to all of my clients that have Medicare and doing comparisons to make sure that their existing plan is good, because each year Part D formularies change. So you may have a great plan this year, but next year they may change a formulary and you may take a tier 1 drug and move it all the way up to a tier 3. They have the right to do that. So it's really important. It's not a set it and forget it election. If you don't enroll in Medicare Part D when you're supposed to, it's a 1% times the national base premium times the number of months. Yeah. So if the national base premium is around $40, they're going to add 1% times $40 times the number of months. They did this because they didn't want people to wait until they absolutely needed the coverage and then enroll.
So when you're saying late enrollment, is that because would that be after the enrollment time? Like, I mean, it goes from,
Yeah.
that's what that means?
So after their initial enrollment, so somebody turns 65, they can
Right.
enroll up to 3 months after. If they don't, and let's say that they, waited 2 years, so 24 months, so they'd be up basically 24%.
So basically, you need to do Part D when you're turned 65.
As long as you're not on an employer plan. If you're on an employer plan, you're good. But just like Medicare A, B, D, you also want to enroll at the same time. If you have coverage through your employer will generally say you have to sign up for Part A, but you don't have to sign up for Part B and D. But you will get a letter, and here's the thing that you'll want to hold on to with your dear life. You'll get a letter from your employer that says you've had credible coverage. When you go to sign up for Part B and D, you want to have that letter with you, because if you don't, they will assess that penalty right from the get-go. And trying to argue with them I've done it. And it is a challenge, to say the least. So when you sign up, this is one of those situations where you want to have the letter in your hand to prove that you've had credible coverage when you sign up. There is a monthly premium cost to Part D. Again, widely depends on the plan that you choose. The initial stage deductible, so there's the monthly premium and then there's the initial stage deductible, which is usually up to about $400. So the first $400 you end up covering out of pocket. Then they call the initial coverage limit, and that's up to $3,700 for copayment or coinsurance. Now, here's the kicker on this right here that they don't explain really well, but that $3,700, that's not just your out-of-pocket coverage. That's the insurance companies and your coverage. So if you take a really expensive medication and you have to pay, let's say $100 for that, but the insurance company paid $1,000, you're a third of the way there. Once you get past that $3,700 of copayment, coinsurance, aggregately, then you go into what's called the coverage gap. You've heard the donut hole, this big, mean donut hole that's going to go away in 2020, but it's narrowing, but it was a very big donut hole. Now the difference is only $1,250. It used to be closer to $4,000. So begins when you reach 37, ends when you and the company pay $4,950, the insurance company. During that coverage gap, you will pay 40% of the brand name drug and 51% of the generic. In the catastrophic stage, which is after that $49.50, you will pay 5% or $3.30, whichever is greater, for the generic, or 5% and $8.25, whichever is greater for preferred drugs. So it's still, I mean, even 5% sometimes is pretty expensive when you think of some of the more costly drugs. And people that are in that catastrophic coverage stage are there because their medications are extremely expensive. Again, getting help for single income around $17,000, almost $18,000, and resources less than $13,000 for Part D, you can get some help. That's where, again, you can go through that same step to get some assistance with that coverage gap is really what it helps you with. For married individuals, it's around $24,000, and resources less than $27,000. One thing for New York residents is that you want to apply, if you're having some difficulty paying for prescription medication, you want to apply for something called EPIC. EPIC stands for Elderly pharmaceutical insurance coverage. It's much easier to say EPIC. It's an EPIC coverage. You do have to be a resident of the state of New York in order to qualify. I'm just going to make this larger. And you have to have annual income below $75,000 for single and above below $100,000 if married. What EPIC does for you, there's actually two plans. One is called the fee plan. The fee plan is for individuals that have a lower income, and they pay, so lower income meaning $20,000 for single, $26,000 for married. You pay a very small amount per year, and then as you can see, the annual fee is at most $300 per year. And then the coverage on those medications are only $3 and $20 based on the medication. So even the most expensive drug is only going to be $20. So if you know anybody that is in this income range, then they will still have to have Part D, but they can go out and get the free Part Ds, if you want to call it that, because there's some of the plans out there that don't have a premium associated with it. And then they can also get this fee plan through EPIC. Again, the most they'll pay for premium is $300, and I've seen people pay as little as $8. Again, this one is, you combine it with your Part D, it will only pay what Part D would have paid. So if there's medications that you're on that Part D says, nope, we're not going to cover it, EPIC isn't going to cover it either. So that's something to be aware of. And then for the deductible plan, this is for people, in my opinion, because the income level is much, much higher. So in this scenario, you're looking at married people at 100, single people at 75,000. Once you get, there's no premium associated with it. There's just a large deductible that you have to meet. Where I recommend that people try to get this plan or sign up for this plan is if they are going to fall into that coverage gap, because usually when you fall into that coverage gap, you're going to have paid enough out of pocket already that you're going to have met the annual deductible. So when you get to that coverage gap, and instead of paying those large premiums, as you can see like right here, and you actually get to take a little bit off of the deductible as well. But you can see if you make around, let's say, $48,000, your deductible is around $1,600. So you have to come up with $1,600 out of pocket. Well, if we go back just to screen, right here, $3,700 is where you're looking at what you and the insurance company would have to come up with out of pocket. So you've probably met that deductible, the side-by-side deductible. At that stage, when you're eligible for the deductible plan, it's the same deal. $3 for generic, $20 for preferred. That's a whole heck of a lot better than $40 for brand, or 40% for brand and 51% for generic. So even though most people say, oh, I won't qualify for EPIC, I usually will look at their income and say, you don't know that you won't qualify. There might be something in there from an income perspective. If your income is under $100,000, there might be something in there that you should have it just in case you have a year where you are spending a lot on medication. And again, I'm a big EPIC fan when it comes to folks that are looking for some additional assistance that are in low income, especially because that fee plan that I mentioned is really good.
How much were the premiums for EPIC?
There's no premium for the deductible plan,
Okay.
but the fee plan, it can be anywhere from $8 up to $300 if you're closer to the 20
Okay.
per year.
Oh, per year?
Per
Oh,
year.
okay.